happy afternoon, a very good afternoon. I hope and I believe all of you are doing well. And I hope I am audible and visible. A quick nod if I'm audible and visible. I'm just waiting for a quick nod, guys. Am I audible and visible? Yes, that's great. Thank you so much, Imran, for that. Thank you, Ravi Shankar. So, in this today's episode, NF100, if you're wondering what is NF100, NF100 is Nikita's FMGE Top 100 topics, right? So, we are focusing on the top 100 topics that are like must know for FMGE exam and which will definitely help you cross that 150 mark, okay? So, we've done with the 4 episodes so far. Episode 1, we have done toxicology. Episode 2, we have done brachial plexus, right, and the nerve injury test. Episode 3, we did the brachial or the pharyngeal apparatus derivatives. And episode 4, recently we did culture media, microbiology, the mnemonics to remember the various culture media. And this is episode 5, which is paranasal sinuses. So this series, if you're wondering where it goes on, it's on YouTube channel and on the Unacademy app as free live class. I keep you posted of the sessions on the Telegram group, Dr. Nikita's VAT Synapse. And this is very, very important because in the recent exams, the topic of paranasal sinuses, we've seen in NEET PG and FMG image, paranasal sinus X-ray image being asked. So that is why this topic is very, very important, right? Yes, PDF I will definitely share on the Telegram group after the session is over, okay? If anyone does only these 100 topics, will it be possible to get 150? It is possible, but you need to solve MCQs also with these topics. Okay, so you need to supplement with the MCQ practice. It's not just these sessions. Any session which you are attending, you have to practice MCQs for sure. Okay. And this is what I'm showing you. Like, this is my roll number for NEET PG 2021. So I've got a score of 640 with a rank of 605 in NEET PG 2021. And so today evening 5 p.m. finally, it's been pending since a long time. I'll be sharing with you NEET PG 2022 timetable. You know, how to plan your studies, what are the strategies that you should be using. And now I can confidently share the strategies with you all since I've got a good score and a rank. So I can definitely tell you the strategies which help me do that even without completing all the subjects. It is, I gave the exam just on the basis of whatever I have taught in the classes so far. Nothing else I've done. So you can trust on that and you can follow the strategy accordingly. So that's going to be a free live class. If asked for a code to join the class, you can use the code Dr. Nikita Live. So all the students who are going to appear for NEET PG 2022, make sure you do not miss on this one. All right. Plus subscription, as we all know, is for the subscribers, and it gives you more structured courses based on your exam. If you're an FMG student, you can follow the batch of FMG. If you are appearing for 2022, you can follow that batch. We have a separate batch for I9CT. So based on the time duration for the exam, we curate the course according to the timeline, right? And Iconic is with Prep Ladder both, which is more cost effective rather than buying either of these alone. So if you are planning 12 months or more subscription, I would say go for Iconic. Now, 10th of October, that is coming very soon, 11 a.m., we have NEET PG Combat. Now, Combat is a 1-hour live test which will have 45 questions, and if you get the top ranks, you can get significant scholarships and the Unacademy Plus subscription. So if you get good ranks, you can get subscription almost for free, if you are in the top rankers. In the special class also, now we have a feature called Raise a Hand. You can talk to the educator directly, the Plus and the Iconic subscribers. And we have free grant test also on a monthly basis. I9CT students, your test is on 17th of October. right? All the subscribers, please make the best use of the question bank, and we have got 60 plus students from our platform who've got more than 600 plus score in NEET PG 2021, the highest being 694, which is like a huge score out of 800. These are the batches that we have started recently. 6th FMG students, you can follow this batch, Focus FMG batch. All right. So let's start with this one. Now, this is a question which came in your FMG June 2021 exam. Okay. So this June 2021, this image was given and it was asked, identify the X-ray view. What do you think is this X-ray view, and it is best for which paranasal sinus? Is it the Waters view? Is it the Cardwell view? Is it Townie's view? Is it something else? What is this? So Jason says this is Waters. Do the rest of you agree to this, that this is Waters view? Now remember that all paranasal sinuses X-rays, they are not Waters view. So majority of you think this is Waters view. So that means this session is going to help you get that 1 mark. This is a Cardwell view. Okay, this is not Waters view. This is Cardwell view, which is best for frontal sinus. I'll come to this image once we've had the discussion, and then maybe all of you will be able to answer this. Okay, why this is Cardwell, I'll tell you that. Starting with the basics of paranasal sinuses. So we have FEMS, that is FEMS. We have frontal sinus, ethmoid sinus, maxillary sinus, and we have sphenoid sinus. If I ask you which of these is related to the medial wall of orbit, which of these is related to the medial wall of the orbit? So this is the orbit and this is the medial wall related sinus, that is ethmoid sinus. Which sinus is very close to the pituitary? And that is why we take that route when we have to operate there in the pituitary. If there's a lesion, we take that route because it's close to the pituitary, that is sphenoid sinus, right? The sphenoid sinus is close to the pituitary. Heard of the term Pott's puffy tumor? Again, this has been asked in your FMG exam and also NEET PG exam. Pott's puffy tumor is related to which sinus? Which sinus sinusitis? Absolutely right. Remember, Pott's puffy is here a swelling in the forehead because of the frontal sinusitis leading to osteomyelitis, subperiosteal abscess. That is related to the frontal. Okay, that's related to the frontal. All right. Now, this is the basic. Why do we have paranasal sinuses basically? What is the role of paranasal sinuses? So paranasal sinuses are air-filled cavities surrounded by bone. So they decrease the weight. Okay, they lighten the skull bones. They cause the air that we are inspiring, it causes air conditioning. So the air is humidified and it is warmed. It provides resonance to voice. So that is why you see when there is sinusitis, the voice also changes. And it acts as thermal insulators. Okay. Which are the sinuses? Very, very important. At birth, which sinuses are present? Out of FEMS, frontal, ethmoid, maxillary, sphenoid, which sinus is present at birth? Yes, Imran, I'll come to that. How do we differentiate Cardwell versus Water? I'll be coming to that. So, which sinuses are present at birth? Just a second. Something wrong with my phone. Just a second, please. So it is maxillary. All? No, all are not present. Yes, Archie, absolutely right. Yes, Sahiti, very good. So that is maxillary and ethmoid. So remember who's present at birth? When we take birth, me is present at birth. Okay. So me, remember me, that means I, me is present at birth. Okay. So at birth, me is present, that is maxillary and ethmoid. So if you see this table from your reference book, so present at birth is maxillary, present at birth is ethmoid. Frontal and sphenoid are not present at birth. The first to be seen radiologically is maxillary. The last to be seen is frontal. Okay, so according to your reference book, the last is frontal. Right, so remember, me is present at birth. What is the lining of paranasal sinuses? What epithelium do they have? Of course, respiratory tract, it's gonna be ciliated epithelium. It is ciliated columnar epithelium. Okay, it is ciliated columnar epithelium. It secretes, there's mucus which comes there. All right. Next one, ciliated columnar. Now I have put these some hidden areas to identify these structures. First, identify this one. If I label this as 1, what is this structure? What is this structure here, the first one? Yes, this is the maxillary sinus, right? The first one, this is maxillary sinus. This one, the second where you see this label, what is this bone here? Very, very important to identify in anatomy. What is this bone here? So this is maxillary sinus. What is this bone? Very good. That is uncinate process, right? So this bone which you see projecting upwards like this is very, very important. This is uncinate process. What is this bone here? If I ask you this, the lower one, what is this? So this is uncinate, and this one which is going inferiorly right below, that is the inferior turbinate. Okay, that is the inferior turbinate. If this is inferior turbinate, what is this bone here coming from the ethmoid above the inferior turbinate? This is the middle turbinate. Okay, that's the middle turbinate there. And which bone is this here? At the roof of the nasal cavity, the horizontal, the bone. If there is trauma, then there can be a CSF leak. If there is dehiscence of that, there can be a leak, so forming the roof. This is cribriform plate, right? This is cribriform plate, very, very important. This is not superior turbinate. I'll show you superior turbinate. It will be vertical bone. It will not be horizontal bone like this. Okay, that's not superior turbinate. So this is inferior middle uncinate process, and this is the maxillary sinus. Okay. This is the labeled image which you have, and look at this one. Where is the superior turbinate? So for some of you who answered cribriform as the superior turbinate, look at this one. The superior turbinate is a vertical bone like this. The cribriform plate is here. Okay, so that is superior turbinate, middle turbinate, and inferior turbinate. If I ask you which turbinate is a separate bone, you can see that two bones come from ethmoid, which is a separate bone. It does not come from ethmoid. Which turbinate is a separate bone? So you can see this superior turbinate coming from this bone, middle turbinate coming from this, and inferior is separate. So remember, that is the inferior turbinate. Okay, that's the inferior turbinate which is separate. Okay, that's an independent bone. Next one, structures opening into meatus. Tell me what opens into inferior meatus. What opens into inferior meatus? What opens into middle meatus? And what opens into superior meatus? Inferior meatus, very good. Remember, the mnemonic is inferior IND for India. Okay, India. The trick to remember, the mnemonic is India IND. So remember the nasolacrimal duct. That means inferior is nasolacrimal duct. It's a nasolacrimal duct which opens into the inferior meatus. What opens into the middle meatus? Middle meatus, M for M. Remember, it is a maxillary sinus. Okay, it is maxillary sinus. You can remember this as frame M. Okay, remember, middle meatus, frame M. You have frontal, anterior middle ethmoid, and maxillary sinus. Okay, so what opens into the middle meatus is frontal, anterior middle ethmoid, and the maxillary sinus. Okay, and the maxillary sinus. What opens into superior? So when you write superior, okay, so superior, PE tells you that it is the posterior ethmoid which opens into the superior meatus. Okay, superior, this is very, very important and easy to remember. Superior is PE, that is posterior ethmoid. Okay, that is posterior ethmoid. And where does now, so we have seen anterior ethmoid, posterior ethmoid, maxillary, frontal. What remains is the sphenoid sinus. Where does the sphenoid sinus open? Sphenoid sinus opens into a recess called sphenoid sinus recess, that is sphenoethmoidal recess. Okay, it opens into the sphenoethmoidal recess. So remember, sphenoid opens into sphenoethmoidal recess. All right. So that is about these meatus. Remember, India, IND, inferior is nasolacrimal duct, and you have frame M for the middle, and you have posterior ethmoid superior. Very, very important to remember all of these. This is for you to revise. I'll be sharing the PDF with all of you, so you can revise this from the PDF. Now coming to the most important, the X-ray views for the paranasal sinuses, right? X-ray views, so you have Waters view, the most important, very, very frequently asked. Waters view versus Caldwell view. What is the difference between the two? Which is done for which sinus, and how do we identify the image? Okay. Now, one of these is nose chin position. That means you can see that if we put a cassette here, the image receptor, the patient's nose and chin touches, and one is nose forehead position. So water, remember, Waters view is like drinking water. Okay, someone is drinking water. Okay, Mihir, so that's why I've shown you the table from the reference book Dhingra that shows that sphenoid is not present at birth. So maybe you can reconfirm from the faculties, but I have shown you the table from Dhingra, that's the reference book. Okay. Waters is like drinking water. And how do we drink water? We drink water like this. Okay. So remember, that is your chin position. So Waters is nose chin position. Okay. Waters is nose chin position. So Caldwell is your nose forehead position. Okay. That is nose forehead position. Caldwell, imagine that this is a house, and in front of the house there is a well. Okay, so there is house, and in front of the house there is a well. So Caldwell, remember, well is in front. So Caldwell is best for frontal sinus. Okay, Caldwell is best for frontal sinus. And how do we look into the well? Like this, right? We look into the well like this, which is forehead goes down. So forehead nose position, that is frontal sinus. That is Caldwell view. Waters is nose chin position, and it is best for maxillary sinus. Okay, maxillary sinus best Waters, frontal sinus best is Caldwell. Okay. Now, thinking very logically, tell me which of these would be occipitofrontal and which of these would be occipitomental. That basically is telling you the X-ray being going from the occiput to the frontal, from the occiput to the mental. Which of these will be occipitofrontal? The one which is for the frontal sinus, right? The one which is for the frontal sinus. So remember that OFD, occipitofrontal, is Caldwell. This is occipitomental. Okay, Waters is occipitomental. Now, how do you identify in the images? You can get these images, or you can get the X-ray images. Now look at this. This is the image receptor. The chin of the patient is touching the image receptor. It's like drinking water, and that is why this is Waters view. Look at the X-ray beam, occipitomental. Okay, look at this one. The forehead is touching, like looking into the well. So So that is Cardwell view. Okay, that is Cardwell. And occipitofrontal. You want to see the frontal sinus. So of course that would be occipitofrontal view. So remember, Waters view is nose chin position, occipitomental view, maxillary sinus. Cardwell is occipitofrontal, best for frontal, and it is nose forehead position. Okay, nose forehead position. And what is Pierre's view? So this has been asked in one of the NEET PG recent exams. Pierre's view is Waters view with open mouth. Okay, so you can keep the mouth open. What is the advantage with mouth open? The X-ray beam passes through the sphenoid sinus as well. So we are able to see sphenoid sinus in Pierre's view, that is Waters view open. Okay, Waters view open mouth. Now, what are we seeing here? Okay, this is the lateral view. You can see the patient is like this straight and the X-ray beam is coming from the lateral aspect. So this is how the X-ray beam is going from the lateral aspect. This is lateral view, and lateral view we will be able to see all the sinuses, and it is good for sphenoid sinus. Okay, and it's good for sphenoid sinus. Look at this one. The X-ray tube is here, the beam going from submento, that is below the mandible, and reaching to the vertex. So this is called as submento vertical view. So remember this submento vertical view, what sinus will be seen? It is going to be sphenoid sinus. So this is submento vertical view or basal view. Okay, or basal view. This is for sphenoid sinus. Okay. Now look at this one. I've shown you the image, I've shown you the schematic diagram. What do you think? Which X-ray view is this? What do you think? Which X-ray view is this? Very good. So this is the chin position, like drinking water. So this is Waters view, and it is best for maxillary sinus. Okay. This one. Now this is how the image is asked, and you are asked to identify what X-ray view is this. Is it Waters? Is it Cardwell view? Okay. So now, because your Waters view is nose chin position, you will see the X-ray, the image of the patient like this. Okay. The image will be something like this, and you will see the maxillary sinus well. Right? You will see the maxillary sinus well. Frontal sinus are not seen. So look at the image. I'll show you the Cardwell view as well. So this is Waters view. This is where you see the maxillary sinus. This is where we see the maxillary sinus. This is the orbit, and this is the orbit, right? That is the orbit. And so remember, this is Waters view showing the maxillary sinus well. This is not Cardwell. I'll show you Cardwell view as well. Tell me, what X-ray view is this? What do you think? What X-ray view is this? Absolutely. So this is your Pierre's view. You can see it's a chin position. So this is Waters view, but the mouth is open. So this is Waters with open mouth, which helps you visualize the sphenoid sinus as well. Okay. So look at this open mouth here. Okay. This is the open mouth, and this is where this air fill thing which you see, that is the sphenoid sinus. Okay. So in the Waters view open mouth, we see the sphenoid sinus, we see the maxillary sinus as well. That is important to identify. Okay. Right. So this is again your Waters view open mouth. This is where we will see the sphenoid sinus. What X-ray view is this? Identify this one. What X-ray view is this? What is touching? What is touching? It's the nose and the forehead touching, right? It's the nose and the forehead touching. Forehead, frontal, Cardwell, well is in front of the house. This is Cardwell in the front. It is best for frontal sinus. This is what was asked in your exam. Okay. So look at this one. and this is how we will differentiate Cardwell from Waters. Now, this is where you see the frontal sinus. Look at the face of the patient. The position does not seem to be like this at all. Rather, it seems like this. Plus the other thing, in the orbit, you can see this bone, which is the petrous bone. While in the Waters view, the orbits will be clear. Okay, you will, in the Cardwell view, you will see the petrous bone in the inferior part of the orbits. So this is Cardwell view. Okay, this is Cardwell view, which is best for frontal sinus. Look at the position. It seems the patient is looking like this. It's not like this. If I show you the Waters view again, okay, look at this Waters view. The orbit here is clear. You do not see any bone here overlapping in the inferior part of the orbit. The frontal sinus is not seen well. Look at the position. This seems to be up. That is Waters view. Okay. So as far as I know, Akhil, in exam, it was Cardwell view which was asked. Maybe it was Waters. So the recall, it's all based on recall. So basically it's either Waters or Cardwell. That is the most basic to be known. How do you identify for the upcoming exams? All right. Everyone is clear. So how will you identify Cardwell? You will see the frontal sinus very well. Rather, the maxillary sinus is not seen well. You will see the petrous in the inferior part of the orbit. So this is Cardwell for frontal sinus. Okay, so this is Cardwell view for the frontal sinus. Okay. Right. So next one, what X-ray view is this? This is the lateral view, right? This is the lateral view, and we are seeing the sphenoid sinus here. What structure is this? Above the sphenoid sinus, this is where you have the pituitary gland. This is sella turcica, and that is why we take transsphenoidal view. Okay, that is why we take transsphenoidal approach for pituitary lesion surgery. Okay, that is sphenoid sinus. Okay. What do you think? What X-ray view is this? It is going below the mandible to the vertex. So this is submento vertical view. And for what sinus do we do this submento vertical view? It is done for sphenoid sinus, right? This is submento vertical or basal view. Absolutely right. So that is for sphenoid sinus. Okay, so this is how the submento vertical will look like because you're taking from below. So we will see like this image, and this is where in the center we will have the sphenoid sinus. Okay, this is where we will have the sphenoid sinus, which will be seen well. So that is submento vertical view. Okay, this is submento vertical view. Right, look at this image and tell me, what do you think is the problem in this image? Is it normal or is it abnormal? Is it normal or is it abnormal? Look at the maxillary sinus here, right? Look at this maxillary sinus, the left maxillary sinus. Look at the right maxillary sinus, right? So what do we see here is the right maxillary sinus is not black. That means it's not containing air. The paranasal sinuses normally should contain air. That means they should be black. If you see that there is fluid like this, it is not black. That means there is a problem there. It is most likely sinusitis. Haziness is seen in the right maxillary sinus. So that is sinusitis. Okay, that is sinusitis. Now, this is a question which has been asked in one of the NEET PG exams previously. At least you should know the name. What is the X-ray view for the optic foramen or the optic canal through which goes the optic nerve? What is? Yes, that was Pierre's view, Saiti. Yes. X-ray view for, very good, Anisha. Absolutely right. Remember, there's something called as Ricci's view, which is done for optic foramen or optic canal. Remember the name? Ricci's view is done for optic foramen or optic canal. All right. And this is how we take the image. Not very important, but you should know the name at least. What are the various X-ray views for temporal bone? Tell me 4 X-ray views for temporal bone, because X-ray views for temporal bone is also asked in your exam. Very good. Very good. Inba, one is Townie's view. Okay, so I write down number 1, Townie's view. All right. What else? For the mastoid, temporal bone, remember, includes the petrous, the mastoid, the squamous, and all of that. So you have Townie's. You have what for mastoid? You have other views for petrous ridge as well. So there is Townie's. In ENT, you must have read. You get in ENT practicals, Schuller's view to look for mastoiditis. Right? What else? There is Stanwer's view. Okay, there is Stanwer's view and there is Law's view. Okay, so these are the various named views. You should know by the name. So remember Townie's, T for T, it is temporal bone. When we say alphabetically PQRST, the S1, Schuller's, Stanwer's, is also for temporal bone. And Law, you know, in our country, law, court is like a temple. Whatever decision comes, we have to abide by that. So remember, Law's view, temple, that is temporal bone. Okay, so you have Townie's, Schuller's, Stanwer's, and Law's view. At least know the name. Okay, at least know the name for them. The image is not really important for FMG exam. INI-CT ke liye we will read later, you know, how what view is, how do we identify. Okay, now coming to some in next 5 minutes or so, let us see the quick anatomy most important on the CT paranasal sinus. Where do we have hiatus semilunaris? In the middle meatus, where the sinus is open. And look at this anatomy. Okay, this is the CT scan because the bones are white. This is air-filled maxillary sinus which we have. This is the maxillary sinus. We have the maxillary sinus ostium here. What is this thing called as, anyone? This dotted line structure. So this is your osteomeatal complex, osteomeatal unit. Identify this. So this is the ostium. All right, this is the ostium. This is infundibulum. Okay, right, you have in the ventricle the heart as well. Very good. That is infundibulum. This is the middle turbinate adjacent to the adjacent to the maxillary sinus. And what do we see here? This is the uncinate process. Okay, this is the uncinate process. I think this is incorrectly labeled. This is not middle turbinate. This is inferior turbinate that we are seeing. The middle turbinate is here. Okay, this is the inferior turbinate. And this is the uncinate process, right? And this part which you have here like a semicircle, that is hiatus semilunaris. You will see the ethmoid opening into it, the maxillary opening into it, right? So that is hiatus semilunaris. All right. Next one, this we have already seen. Look at the lateral view. Okay, look at the lateral view. So we have the inferior turbinate. We have the superior turbinate here. Posterior ethmoid recess. We said that posterior opens into the superior meatus. Okay, so this is where it is opening into the superior meatus. This is the sphenoid sinus, sphenoethmoidal recess, opening into sphenoethmoidal recess. Okay, we have anterior ethmoid, right? We have maxillary sinus. These open into the middle meatus. Okay, what is this frontal sinus called as? The anterior most, anyone? This has been asked, I think, again in the recent INI-CT exam. What is the name of this anterior most frontal sinus that we are, air cell that we are seeing there? Very good, Anisha. So this is agar nasi. Okay, in front of the frontal recess, we have this cell. In front of the frontal recess, that is agar nasi. Remember, agar nasi is anterior. Okay, agar nasi is the anterior most in front of the frontal recess. All right, that is important to know. And look at this one, the nasolacrimal duct. It opens into the inferior meatus, right? It opens into the inferior meatus. What is the direction? It goes downward, lateral, and backwards. Okay, that's the direction of nasolacrimal duct. So remember, it goes downwards, backwards, and laterally, opens into inferior meatus. There is valve of Hasner at the inferior end. Okay. Optic nerve is related to which sinus here? Optic nerve is related to which sinus and its superolateral relation? This is the sphenoid sinus. Okay, that's the sphenoid sinus. Above that, we have the pituitary. So remember, optic nerve is related to the sphenoid sinus, a variant of sphenoid sinus air cell, which can cause damage to optic nerve during FES. Remember, that is Onodi cell. Easy to remember. Onodi is the one which is related to ON, that is optic nerve. Okay, that is optic nerve, Onodi cell. Okay, Onodi cell. Right, now this anatomy we have already seen. This is your maxillary sinus, you have the infundibulum, uncinate process, you have the middle turbinate and all of that. All right. Right, again the same thing. This is blue color is the middle turbinate. We have the middle meatus here where the sinuses are opening. You have infundibulum, hiatus semilunaris, and this large one here, lateral to uncinate, that is called as ethmoidal bulla. Okay, that is a large large cell ethmoidal bulla. Okay, that is ethmoidal bulla. Okay, now this we have already seen, frontal sinus, sphenoid sinus. If I ask you what X-ray view is this? Anyone? What X-ray view is this? And this is done for which sinus? Yes, this is basal view going from the base, submento vertical, or the basal view, which is done for the sphenoid sinus. Very good. Absolutely right. Okay, very correct. Okay. Let's see this one. What do you think this X-ray view is? Is it going to be Waters or is it going to be Cardwell? Is it Waters or is it Cardwell view? Look at the orbit. The orbit is clear. You do not see the petrous ridge here. Okay, we do not see the petrous ridge here. The bone which you see is here. So this is your Waters view. Okay, this is not Cardwell. This is Waters because the orbit is clear. Okay, the orbit is clear. Okay. This anatomy we have seen, and this is an important variant that we should know. Haller cell again has been asked as an image-based question in the previous year exam. So the air cell which is related to the inferior wall of orbit, okay, this one is called as Haller cell. So remember, Haller is infraorbital. Okay, Haller is infraorbital air cell. The other ones which we saw is agar nasi, which is anterior, and onodi, which is related to the optic nerve. So these are some variations that we should be knowing. Okay. So this is about the paranasal sinuses. Now if I take you to the first image that I had asked, I think this we had discussed already, right? This is Cardwell view. Now everybody is clear why this is Cardwell, because in the orbit you are seeing the petrous ridges, right? In the orbit we are seeing the petrous ridges, and that is why this is Cardwell view, which is for frontal sinus. Okay, so some pathologies of paranasal sinuses and a quiz on paranasal sinus anatomy we will have in one of the upcoming special classes for your revision. So we will combine the pathologies like sinusitis, enterocoinal polyp, your coinal atresia, and all of that we will combine with a quiz in one of the upcoming special classes. So please revise this topic. I'll keep you posted, and we are meeting again today at 5 p.m. for a special class for NEET PG 2022 timetable. You know how to plan the days, how many days you should give to each subject, how you should make sure that you are not missing out on MCQ practice, and how will I help you in your preparation for NEET PG 2022. So all of that we will see in a 5 p.m. class. Yes, the NF100 topics, like I get a lot of queries on that. The NF100 series that is going on, which is FMGE Top 100. Remember, this is like must know for every exam. Okay, must know for every exam, be it FMG, NEET PG, INICT. It is essential for all. NEET PG, INICT, there would be some more extra edge topics that we'll need to cover, but these are like common to all. Okay, so everyone should be watching this. Keep a check on this, and I'll keep you posted of the upcoming sessions. We have a session today at 5 p.m. and 9th, we will have the next YouTube live class on 9th again at 12 p.m. which is going to be fast 5 MCQs for I9CT students targeting I9CT. Some clinical conceptual questions is what we will have. So you will have YouTube live sessions this month, Tuesday, Thursday, Saturday at 12 p.m. Okay, Tuesday, Thursday, Saturday, 12 p.m. we will have the YouTube sessions, and special class we will have every day at 5 p.m. on the app. All right, I'll be sharing this PDF with the annotations, the written thing as well, on the Telegram group, Dr. Nikita's Rad Synapse. You can get it from there. Okay, thank you so much everyone for joining in, and goodbye, take care, keep studying, keep revising, and keep winning. Thank you.